to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Sorry.
Right. Thank you all for joining us on this holiday week. If we can have a motion to approve our minutes from the last meeting.
Motion to approve.
Thank you.
Second.
Dr. Lawson,
Yes.
Dr. Brunt,
Yes.
Robin,
Yes.
Dr. Hassan,
Yes.
All right.
Linda.
Yes, thank you. Okay, so next board meeting is scheduled for August 5th. Please make time go by more slowly.
Oh, yes.
August yet. We can move on to new business. MOU with Lake County Share XRF Lead Analyzer.
So what this is state lead analyzers for every district. So some of them we have and some of them are not mine, but they purchased enough for each district to have it. And we have had one since 2022, I believe, was when we originally entered into the agreement with the state. We redid our agreements and we just entered into the new one this year. And at this point, if we want to share with another county, we have to execute our own. They used to put that on their agreement. We could let them know it was just part of the agreement. But now they've asked that they're only doing their MOU with one county, which is us, and then we then would write our own MOU with another county to share. So Lake County did request whether or not we would consider sharing our analyzer with them. And so put together the MOU that you guys received in your email and had Dave review that. And so we're just asking for any discussion that you have, feelings on it, and then it would be a vote if it calls that to.
Are there any concerns on your end?
There are not. So we sent our analyzer out and Tony was leaving. He sent it out right before he left at the end. And
23?
we thought we got it back.
And 23?
Yes, 2023. We thought we got it back in the mail. And Dave was like, when he got trained or went to go use it, because we were going to contract with Tony in the beginning, didn't have any cases. And he was like, this is off by a number. And so, then he went to use it. And then this year he's like, these batteries won't hold charge. Well, it was a loaner.
Oh.
We just received ours back a month ago.
no, we got it back.
A couple weeks ago.
Yeah, it was right before the health fair.
And it was where?
It was still getting repaired all that time. We had needed
Oh
a
my
new
gosh.
pistol because it's
For 2 years.
yes. So that was a very long time. So now our machine is in good working order. So
Yay.
of course we wrote into the MOU shared maintenance costs with the county, and they would hurt it while they have.
Yeah.
They're responsible for
Okay.
that, and so I don't have any concerns. Honestly, they're gonna need it more. They're gonna
Okay.
need more cases.
And so now a whole district shares one?
It's just whomever. So Lake County is the only county that has approached us.
Because we have what else in our
Just
district?
that many. We entered into the agreement, and then Lake County approached us and asked.
Could somebody else ask us too?
They could, and then
How many are in our district? Before it started?
5. I know that some of the districts, because of their size and they don't necessarily have somebody on staff, they third party.
Oh.
And that is actually what Lake County has been doing, but in looking at the cost of that.
This is better. So then they pay us portion or no? Just the share?
There's no
cost.
No fee.
Yeah, so it would
Oh, okay.
only be maintenance cost. You would share in any maintenance costs if we need to buy new batteries. If they would break them while they had them, they would be responsible for that repair. So.
Okay. Well, if you are agreeable with that plan, then I will make a motion to approve the MOU with Lake County to share the XRF lead analyzer.
I'll second.
Okay, Dr. Lawson,
Yes.
Dr. Brunt,
Yes.
Robin,
Yes.
Dr. Hassan,
Yes.
thank you.
Thank you. Any old business to share? report of our board attorney.
Brevity is a virtue, so I
Amen.
will be short.
Thank you.
But I am going to ask Susan to come up and join us. As you will recall, I'm sure, you authorized implementation of our program where we make the restaurant test results public. They're public record anyway, but put them on our website. Susan and I have been about the task of attempting to accomplish that, and I'd like her to report to you where we are in that endeavor.
Sure. Demetrius and I had a meeting and we talked about what this could look like for putting these inspections on our website. Then Demetrius has submitted a ticket to Tyler Technologies to get that going, to have that'll be a bullet point on the list. It goes to the foods division, but that takes a little doing. It's not just something that we can do right off the bat. So, and then in the meanwhile, the ongoing FOIA request, I sent her first batch today. So from June 1st to June 20th, so it's July 1st, I sent from those days. And then I've set it up the next batch. I just email them to her one at a time.
Approximately how many were there?
Today it was 47. This is, of course, we're getting on board with a new code. If you look back at our numbers, our routine inspections can be in the hundreds. So,
Here.
yeah, so that will grow as our inspectors are going to town. They're really doing well with the new food code. So it maybe took me an hour to just, by the time you get all the little interruptions and stuff, to email all of that information to her. It wasn't bad at all. So I've set up my next batch. I will email to her on July 21st. So I'm just setting that up, to send 20 days worth of inspections 10 days after that last day becomes available to the public.
Are you email?
Public FOIA request.
Oh, public FOIA request. Okay.
Yeah, Freedom of Information Act
Okay.
request. Yeah. So that's going well, and then we're getting more information about posting them on our website. So I think we're making progress in both directions. So
Do you think it would be worthwhile to have, when we do get to that point, like something? Because I mean, when I went with Carrie once back in the day, just to watch what you guys do, just like a explainer. I mean, there's just so much, and to explain what this means, critical versus, whatever, like something so that people can understand, what, because I think sometimes it can look worse than it is. Does that make sense?
yeah.
And just to explain like those type of criteria.
Yeah. So we could put that information underneath our, like kind of with our ticket on our website, and just kind of a brief.
A glossary of terms.
Yeah, maybe, yeah.
I mean, not necessarily that intense, but just how could they interpret it if they don't know
Right.
what the terms mean?
I mean,
Code.
there's the code. That's what I was going to say. We do have the code, and the new code is posted on our website, so we could also refer them to
Yeah.
that if they want to look. And there's all the numbers are on the inspection, so they can take that number
Put it in.
and go to the code, look it up. You can use that
That's good. Yeah.
Very.
No,
Control F.
one thing Susie has asked the state for that would be awesome as well to pair with it is public health reasons. So our old code had public health reasons that we also have on our website. That kind of works hand in hand with the code to see why it, in that case was critical or non-critical, and kind of explain why it's a violation. So those things would really work hand in hand, but that is not something they've published with the new code.
Not yet. They're hoping to, though, I believe. So it'll just take a little bit to get the public health reasons. But honestly, I feel like the new code, it delineates things a little bit more clearly on some of the items that we've been dealing with. It's more of a list. So that's good. But then there's also a lot of code that refers to other code. Over and over, especially the plumbing code or whatever, I mean, we don't try to overlap too much, but we just point people in the direction of a different code.
as part of what I reported on last time, I think I made reference to the fact that there is a growing interest in what we do, and that's manifested in public record requests of what we do. And we just got one again today, that the magnitude of which could be greater than what we're dealing with when it's
Yeah.
on our website.
He just wants though the owner. He wants the name of establishments, the owner, the address, the phone number, the email address. That's what he wants. He doesn't really. He's not really interested in an inspection.
But is that what we provide, or
I don't know.
it's where you come?
That's what Dave's looking into. That it was, yeah. He's done this other places. I looked him up online. He's done this in other states, other counties.
Well, you guys are so busy. You do so much, and I'm all about transparency and freedom of information. But I don't want to create workload for you that isn't your workload.
I appreciate that.
Be in charge. So,
Any questions?
thank you for all of your hard work.
It's been good.
It's been easy.
Thank you.
End of my report.
Okay, thank you. The claims and receipts went by as we came back. We did.
Michelle.
The claim did it come back this
Yeah, one.
It went back.
Did it come to me?
We'll find it.
For you to sign. I think
Nobody
I signed it,
leaves.
Did we?
You gave it to me. I gave it to him.
Kidding.
Maybe it's
Kidding.
your pile.
Okay. Oh,
It appeared out of nowhere.
He's taking people. I'm like, he's taking people.
once we give Michelle a chance to review, we can have a motion to approve our claims and receipts.
Approved. I did look at it. Motion.
Second.
Yes.
Yes. Yes.
Yes.
Yes.
Okay.
Welcome.
Reports of committee staff and health officer.
I'll just be brief. I'll be brief. Our continued hunt for the next Porter County Health Department Administrator continues. We had 2 interviews today. I think we have 6 on the books for next week, interview-wise. So they continue to come in every week and trickle in. We got some over the weekend, and so it's going well. We had a brief meeting this morning with Powers Health about the Rudy program, pre-diabetes screening, and I think they'll be presenting next meeting, and they had really good results, like very promising, but also talked about other opportunities to partner with them for some of their other types of screenings that they're offering, which I think would be excellent. We'll get more information next meeting on that too, but yeah, so that's all.
All right.
I will be really brief as well, and then we'll let Haley wrap us up. That's okay. But I had handed out today, as you were coming in, or as we were getting settled, it looks like the budget form. And so this is Jeff and I got together and we talked with the Department of Emergency Preparedness, kind of about what other counties are doing with their budget. And we kind of looked at where the fund is at right now in the second half of the year and kind of what we could do with some things. And so that's what you see before you. It is on the agenda, so we will not be able to vote on it this evening. We also have not received a letter from the state for a grant that they say we should be getting money for, but that would start today. So, but we did kind of want to put this together so that we could kind of have a conversation about it. You could think on it if you have any other ideas. Then we could kind of be ready to talk about this in August and actually vote on the second half of the year.
Tell me again what the medical and dental line is.
So that is a couple of different things. So one thing is, and I forgot about this when we were talking earlier today, fit testing. So we do not, none of our current staff are fit tested for an N95 mask. You know, we started to do it with Franciscan at the beginning of the pandemic, and it, like, some people weren't able to be fit tested, and it just kind of dropped off. But part of that would be to be able to get our we could do our own fit testing, because as we get new staff, or if we had to stand up a pod and we needed to fit test other people, or temporary staff or part-time staff. And so part of that is that, in addition to being able to purchase a mask that would fit, so that everybody can have a box of masks that is right for them in the event that it's not one that we would have, the one that we have. So that's part of it. The other part of it is for AEDs and those Save Heart stations, the outdoor cabinets that we purchased with some 2024 funds to put out at the parks. We would be able to use this funding to put them at our pod sites and other training sites that we use for emergency preparedness. So we thought, since, of course, ultimately we would like to be a heart-safe county, that would add to that, those in those locations where we could potentially be setting up community-wide sites during emergency preparedness. So that is what that line item is, that large line item. And I apologize because I gave it the wrong route, so I don't have it. I tried to do the justifications on the other page, but I know sometimes there's only so much line.
Well, and this was part of the attempt of us using this grant fund for more things that we typically use from our HFI or general funding.
Yeah.
Now we have a little more available that we can.
Right. So those would be line items that, again, we had to cut from our Health First Indiana budget. We knew Health First Indiana was cut, but some of them, so the vehicle repair, the telephone, the other rentals, those are all line items directly out of our current budget for 20. So should we get the grant or letter, then those are items that we can
Save that money.
Right, exactly.
Oh, that's amazing.
So that is kind of what we're looking at. We did identify 2 individuals in the health department internally who would like to be back, so they'll be trained as backup in the position. And so a little bit of money for travel and net for them, because they do have to do some offsite meetings for that. And again, that might not all be used. Sometimes the trainings, we can find them for free. It might just be a hotel stay, so we wouldn't, use all that travel. But that's just kind of what those things are in there for. Another big area that we can hit is communication, because there's so right. If there's an emergency, we have to be able to communicate with everybody. And so we talked to Demetrius. He has the radio show and the podcast on WBLP, and right now he does all that recording in studio, and they edit that, and that's just for that radio show and podcast. But if we had the equipment where he could record and edit here, we could create PSAs and we could send them out to everybody, right? So that all of his media contact. And so that was something that they said absolutely that can be used out of here. So
And what's the time frame? Is it just a one-time sum, or is this a renewable grant? What is this?
So it's been a renewable grant for years,
Okay.
and as you can see, it's gone up considerably in 25. Well, 24 and then into 25, because it was, but this year, we've lost our other CDC pass-through grants. This is also a CDC pass-through grant. We know that the state has received their award letter, and that they got cut millions of dollars. We don't yet know what that means for us. So we have not received an award letter. So the word is that money's coming. We don't know how much. We haven't received that, and it's a January 1st to June 30th grant cycle.
Okay.
So it should have started today.
But we haven't gotten the letter.
Correct.
Which is
Okay.
normal.
Which
It's
unusual,
can't be more.
right? We've had them come late.
We did
Okay.
receive attachments A and B last week to bring you in that they're way fewer deliverables than. So we don't know what that means.
Very good.
So yeah, this is what. And then of course, should we receive the funding, and based on what that is, then we will have to come before with a proposal for 2026 budget, which we aren't even talking about here. And then we know that won't be able to budget meetings. We'll have to go before council once the board approves it and do that in January. So
Very good.
anything before we turn it over to you?
You're up. Thank you. And I mean, all of your reports, like, I don't want to take time, but we're doing good, going fast. Very proud of you all. Like, I love them. Staying busy in the summer. I love for joining.
Thank you for having me. Am I too loud? Okay. Hi, everyone. I'm Haley. I am the Fetal Infant Mortality Review Coordinator for Porter County. This is a relatively new program. I started in November of 2023 and was tasked with creating this team here. Indiana, most counties have a femur team, not all do. We just went over the recent numbers at our public health nurse conference. Some counties have come together to provide this service. So, for example, Lake County also took over Stark and Jasper as part of their femur team. Femur is different than any other fatality review. We have a part of it that requires an action to be done. So, no matter what we review, we have to create an action for the county that we're living in to have better outcomes for our children and mothers. So currently on our team, we have 35 members and it's continuing to grow by word of mouth. We have OBGYNs, pediatricians, labor and delivery nurses. One of them is the director of the labor and delivery unit of Northwest Health, along with the educator there. We have doulas from Franciscan and also private doulas, social workers, the prenatal care coordinators, and coaches from Geminis. First things first, we have teachers, VU and Ivy Tech faculty and students that sit in, maternal fetal medicine from Northwest Health, nurse family partnership home visiting RNs, the coroner, and then other public health nurses.
It's pretty awesome to start from scratch and have that type of quality of.
It's been challenging but very rewarding.
Yeah. Well done.
So far we've had 6 meetings. The first meeting was July 1st of 2024. So again, it's I tried to do it so when this program was initiated that people wouldn't feel tasked to do this frequently. We had enough time to review them, and people would want to stay on board with this process. So the idea is to have quarterly meetings. We'll do a winter, spring, fall, summer kind of ordeal, but also that can change with the amount of deaths that we see. So this is kind of what we do, our process, just so you guys have a better understanding of it. I get notification via Vital Records. We begin case selection. We investigate deaths where the mother resided in Porter County only. So it's not all of the babies that have died at our facility. It's only the moms that have an address in Porter County. It's from 20 weeks gestation to 1 year of age, although that can differ a little bit. An example would be a 17-week-old gestational fetus that was born that had a heartbeat. It's now not a fetal death certificate, it is a infant death certificate, so we would review that as well. We obtain the medical records, including all prenatal information, ER visits, postnatal information, pediatrician visits, documents from the police officers, coroner, DCS, and medical examiner if those are available. I do try and set up a maternal interview. This is only for mothers that are not involved in any type of ongoing psychiatric care that may not enable them to participate in an interview for their health and well-being. Also, if there's any ongoing police investigation, because we don't want to interfere with anything like that. I then de-identify the cases and create an abstract. This is unique to our program only because if you've ever sat on a child fatality review, they are not de-identified. The whole purpose of this program is not to prosecute. We are just trying to simply find ways to create healthier babies, mothers, and families within our county. We do set up a meeting with our femur team. We review the case. We also fill out a team decisions form. I have an example of it. It's quite a number of pages. It's been provided by the state. Porter County itself we do every item on this. And I'd be happy to share this with you if you're interested in it later. But it basically, we asked the team, do we agree with the cause of death? Was there something that could have prevented this death? Was it prenatal care? We go over all types of legislation too. Was there something that could have been done at the federal level that would have prevented this? State level, community level, provider level. So we do try and look at all aspects of this individual's life and how we could have done better. After that, the data from our investigation is entered to the state. We use REDCap surveys, and then the information is brought to the action team. The action team is not fully formed yet because we're a brand new review team. We essentially already have an action team within the community. It's just kind of onboarding everyone and explaining our data statistics and what we really need. What we see right now is we do have a high number of third trimester fetal deaths. And honestly, after reviewing a majority of these cases, there really isn't any direction that it points to. A lot of moms are receiving all of the prenatal care that they're supposed to get. They're starting at the right time. There isn't drug abuse going on. There isn't insurance difficulties with all of the cases. It's just more of a mother's intuition. She felt something was wrong. She went to the ER and there was already a fetal demise. However, conversely to that, our infant deaths, since 2022, we have had 8 of them. Out of the 8, 5 of them were deemed by the coroner to be co-sleeping or unsafe sleep conditions. However, 8 out of 8 were all unsafe sleeping conditions. So something just statistical data to look at. And then what we have participated in thus far is a FEMA team. First things first, they focus on prenatal to age 3 and within our community, Porter County only. They do something called Camp Collaboration. It's a place for all of us to get together once a year, communicate with each other how we can help one another provide services. We have done community baby showers. We are featured in the National Center for Fetality Review. And we have included safe sleep practice in our immunization education as age indicated for all children that we see in clinic. Upcoming, what we are currently working on, we have a few grants that we're trying to go to write to support our ongoing initiatives. We are hosting our first Porter County Community Baby Shower in October of this year. We are working on putting together brochures and other resources for our community, not necessarily just for the patrons, but also provider to provider to understand what's available out there. I think that's also something that everyone struggles with. If you do get a patient in the office and they are finally verbalizing that they do need help with something, how much time do we have and how many phone calls can we make to find the right person? So connecting the pieces is a big part of what I'd like to do here. Training, one of our goals this year is to get our staff trained on safe sleep training and provide that within the community. I think that's it. Does anyone have any questions? And here's just a visual representation. These are 2 separate case abstracts that I have typed up. So this is a infant death and this is a prenatal death. They vary significantly depending on prenatal care, coroner report, toxicology, again, all of that good stuff. So these can be quite an undertaking when we're doing a review process. So although we've only reviewed up to this point 15 cases, we can do about 3 in 2 hours so far. There's a lot of dialogue that we have between providers. So
that's by having 35 people on this team is so nice that are willing to take. That's a lot. That's a lot to review a case like that. So, and all of that documentation. So it's nice that you have a good pool to work from. So when you, like, I was reviewing what you had sent us, like with the your summaries of death article, was there anything more that like you could glean in terms of other things that we could focus on in terms of risk factors? I mean, certainly I saw things with BMIs. I think it would be nice if we could put BMI prior to pregnancy and then Because I think it's sometimes
It's skewed. Yes.
to give me my BMI at my end of my pregnancy
I'm pregnant.
versus what,
Gain weight.
right? Yeah.
Yes.
So I think coming in, you had documented one coming in that had a very high BMI before pregnancy. I think that's an important topic for us to. Obviously, obesity is a risk factor for over 60, different conditions. So this, from what you guys put together, seems to be something we should be, aware of. Smoking, right? You shared with me the safe sleep statistic, and I mean, I'm just appalled. It's been a minute since I've had a kid, and so I'm not as frequent with dealing with new moms, but it's just sad to me to think that it's still something that we need to do so much better in terms of our discussions when you say all 8 of your cases had poor sleep habits.
Yeah, there was a factor related to unsafe sleep, and it's a lot of re-education to providers, to not just providers, but one of the infants that we looked at fell asleep on a bobby alone on his back in a crib, but on a bobby. A bobby is considered unsafe sleep practice, so it's just little things like that.
Little but huge.
Right, correct. Car seat safety, it isn't.
It reminds me of like the water safety, the pool safety.
Absolutely.
Like seconds something can happen, and just for us to drill that into the parents.
I hate to throw a monkey wrench in, but I just saw some data that suggests that potentially co-sleeping actually reduces some adult anxiety and issues with mental health. So that's starting, and it's starting to be questions though. Fair enough, but I'm telling you, that they're going to start questioning it. They're going to start.
And you get conflicting information. If you talk to
Right.
a lactation
Right.
consultant and you talk to a nurse or a provider,
Right.
might get 2 different answers.
Absolutely.
So we as professionals speak different languages, which causes confusion.
Right.
And things that you see, you go into stores and they all have bouncies,
The bobby was
the
huge, and my kids
the
yeah.
pads on the side.
Yeah, and they're all cute and go with your theme. And
I will tell you, there is some maternal interviews from Indiana mothers, and they are available online to watch. I think they're very helpful, only because these families are sharing their experience and what they wish they would have known. And this community is, it's a very small community, and it's not nearly talked enough about.
Right.
So these mothers that have the opportunity to meet each other and support one another, it's pretty powerful what their resiliency coming out of a fetal or infant loss. But their stories are online to watch if anyone's interested.
Chris, were they measuring subsequent anxiety, or were they in the child, or were they measuring parent anxiety?
So unfortunately, I didn't pour through the data. I do a lot of digests because there's just no way to get to.
Because I was just wondering, like, I think co-sleeping sometimes
Right.
reduces the parent's anxiety.
Oh, absolutely.
But I think, like, if we're looking at predictors of reduction of anxiety as an adult if you co-slept as an infant,
Right.
That's a whole longitudinal study that's very different than
Right.
reduction of anxiety in
No, they're looking at children and adolescents and teenagers as far as like mental health issues,
Later on.
things along those lines.
Yeah.
So as far as co-sleeping and not co-sleeping, and once again, I mean it's not gold standard, but there has been a huge, as you probably could speak to better than I can, a huge mental health spike over the past few years, and they're looking into whether or not these recommendations that we're making, because sometimes we make blind recommendations, and once again, yes, it is abundantly clear that 8 deaths have happened with children, and who can look at that and say we don't want to fix that issue.
Right.
But the flip side is, what's the damage of the fallout damage of the recommendations that we're making without looking at what the outcomes are from that recommendation that we're making. So we can't sometimes blindly make recommendations without sometimes looking at the fallout on the other side of the
right, and looking at the correlational data and then thinking about what other actual factors
right
play that would like if you did an ANOVA or some other kind of data analysis.
Once again, it was a digest I was listening to. I listened to a lot of podcasts and read a lot of digests, and it was actually a podcast I was listening to, and the two people that were having the conversation were talking about the fact that they're starting to analyze that because we've just been blindly making this recommendation on the on the information of
For academic guidelines.
of the deaths, right? But of the deaths, right? What we haven't. It's kind of like during COVID. I think one of the problems that some of the public had with public health official recommendations that were made were the fact that they were made based upon only one unilateral criteria or metric that we were looking at, which is fine, and I understand that that's an important factor. But then the question is, what is the back end of that fallout? And we need to always have that in mind when we're making those kinds of recommendations for people. Are there downsides to the recommendations we're making? I mean, I'll give you an example. We've been making prostate recommendations now for 30 years, and the data is abundantly clear that we've done much more damage to men by screening them for prostate cancer than we have actually done than actually saving lives. And that has been a 30-year practice that we
But
have.
the guidelines changed.
I understand that, but what I'm saying,
The guidelines.
I don't disagree, but it took people looking at, all we looked at was guys are dying of prostate cancer. We're trying to keep people from dying from prostate cancer, which is a noble goal. But the fallout of that was far worse than the metric that we were trying to fix in the
Pap smears too. Those
I don't disagree, but it is very easy to look at infant mortality and say we don't want children to die, which is, I don't think anybody in this room would say we don't want children to die or we want children to die from co-sleeping. Not a single person would, if you took a vote around this room, would say, yes, I want that. So we are all in the same agreement to that. The question is, what is the fallout in the back end of the recommendation that we're making as from public health?
And there's a lot of factors that go into it.
Absolutely.
Right.
That I can't afford
Right.
for a baby to sleep. I don't know the resources
Absolutely.
that can play or a crib.
cultural factors.
Very much. I can't tell
Right.
you how many blankets I put in a bed. I'm like, every time I walk in a room,
Yeah.
"Hey, we
Absolutely.
just take this out, keep it over here."
Every baby's cold.
Yes.
Yeah.
Every baby's cold. No, they're not.
And are those things? Where is the baby shower?
We are having it at the Porter Community Health Foundation. Okay. It's right off of Calumet across from the old fairgrounds. And we have already started marketing it. We're really going to go full speed here. We've asked all of our counterparts involved in it to do that as well.
And so then, will they have the opportunity? Like, will there be things like pack and plays, or what will there be there?
So every organization has been asked to donate a raffle item. All mothers that are coming in are going to get a bag from us. It'll have information about things for prenatal care for mom, including immunizations that, a Tdap or an RSV have indicated, and then go into immunizations for baby, as well as safe sleep information, car seat safety. We will have car seat inspectors there with the Roth ID tags. There are going to be social workers there to talk about postpartum care, talking is teaching, all of the prenatal resources that we have in our area, nurse family partnership, visiting home nurses.
That's awesome.
So we have all of these great resources, and moms will get the opportunity to win prizes and learn about everything within the community for them.
Awesome.
That's great.
Can you share that link we were talking about with the moms?
Oh, the videos.
Oh, yes.
That would be great. I think having seen the moms on the opposite end once they've lost a baby, you just don't think it's ever going to happen.
No. It
So,
reminds me of pool or water. It's
And-
the same.
and there were two of the kids that we had for a long time in the NICU that we had lots of conversations. And then when the baby ended up passing away after they went home, it was, when that mom comes to talk to you, she's just, it's hard. So.
We would love to invite you to our next meeting. It's in August, so please just reach out to me via email. There's a confidentiality form, and it's via Zoom, so you can log in at your own time and just to listen, just so you can get a general idea.
Great work.
Yeah.
And I really like that they're developing an actual plan. You know, when we find that's the whole purpose of this, right? To find the commonalities. Where are these things that we see over and over again that need to be addressed?
Correct.
So, good job.
Thank you.
Yep.
Thank you all.
Okay. Miscellaneous. Anyone? I saw like the recap of the health fair,
Mm-hmm.
which again, applause to all of you. We even didn't have the best of weather, but it didn't seem to make a dent in anything that you guys accomplished. Is there? Can you give us just a little?
Did you guys see the video? Would you like to see the video?
Yeah.
It was
I don't know
video.
that I saw video. Did you see a video?
No, I was gone that week.
Demetrius,
You had a good experience.
am I okay to play the video? I mean, I have it, but is it okay? I'm asking you if we'll get in trouble.
You're gonna get in trouble.
Bye.
Video is.
So say what what do we
Uh,
get in trouble for?
No, because you threatened them.
We could just apologize.
You're right, actually.
You're a disgruntled.
Also, like the second annual Porter County Health Department kickoff to summer health and wellness fair.
Okay, the amount of girls getting haircuts was
Yeah, that's
Hey.
cute.
Awesome.
Was that the
Hey.
Chris and I played the wrong thing?
They took.
and I read their article. That was nice too.
Mm-hmm.
This is the one. I'm sorry.
Hello, Porter County, and welcome to the second annual Porter County Health Department kickoff to summer health and wellness fair. We are so excited to have over 40 community partners here celebrating with us,
43.
providing services,
Wow.
activities, and more in our Porter County community.
You come out here for back to school screenings. We'll have dental screenings. We have vision screenings. We'll offer immunizations. We have back to school physicals.
Hey.
Everything you need to get your child ready for the next school year.
The Sacramento Foundation, along with Northwest Health, are here offering their heart screening. People from IDEM here talking about just sanitation and things like feet safety, washing your hands, tons of different outlets for people with addiction, recovery stuff here. We have our fire department, local police department here.
We have Denmark College here that are offering free haircuts for the kids. They're doing face painting, and their medical students are coming out with screening.
Great opportunity to see what's going on in our local community and who you're representing.
So we have a new twist on this year.
here.
We are partnering with the Southeast Army Corps. Another twist this year, you may notice this awesome shirt that we're wearing. Back in April, we kicked off a t-shirt design contest that was open to all the students of Porter County, grades kindergarten through 5th grade. We had dozens upon dozens of entries. So we have a winner, and we presented her with her brand new bike, her helmet, and her lock. Thank you so much, young lady, for participating.
I love it.
It's been a learning opportunity, learning experience, knowing how much our local health department does for the community, the services that we offer. And so this is a great opportunity for the public to see what exactly the local health department of Porter County does.
Public health is really community-based health, and so the number of people that are here, the number of things that we offer is really a testament to the great community that we have and all the things we have to offer. Thank you.
That was awesome.
Oh, nice.
I like how
When children came to get the backpacks, they kind of filled out a little questionnaire about like what school system they were from and what grade, and I thought that was kind of cool. And I think did Hannah make that little thing that we got, you know, to see like all the different school districts that the students came from, and I was, you know, it's kind of impressive. They were kind of far and wide, so that was was cool.
It was really neat to see the whole age span.
Right, the
Yes,
distribution of the
yeah,
grades.
Yeah.
Yeah. Yeah.
Mm-hmm.
And they had to be there to get a backpack. So.
Yes. Yes. Yeah, they questioned them. They had to stop at different booths and such. So it was a lot of fun. Great job. Okay. Well, any public comment? Okay. Well, then with that, I will take a motion to adjourn.
I moved to adjourn.
All in favor?
Second.
Aye. Off to Moana. Go.